centered around the human papillomavirus. From the 24th of October, the cervical cancer screening will begin. And we have on the line Mrs. Elizabeth Ladipo. She is the Deputy Director, Advocacy Communications for Social Mobilization. And I'll be having that conversation with her here today. Hello, good morning, ma'am.
Good morning.
Yes, how are you doing today, ma?
To God be the glory.
Thank you so much for joining us on the show today.
Thank you, too.
All right. So that we can just head straight into the conversation. Can you talk a bit on the HPV?
Yes. Thank you very much for this question.
Okay.
HPV stands for human papilloma virus.
Okay.
This virus can infect many parts of the body in both men and women. There are over 100 types of HPV viruses. There are low and high risk types of HPV. The low risk type is rarely associated with cancer. The high risk type is more likely to develop into cancer.
Okay.
HPV causes almost all cervical cancer in women. HPV is also responsible for other cancers like anal, vaginal, penile, and vulvar cancers.
Okay. So for the benefit of people listening who don't know what HPV is, please, what is HPV,
Yes.
ma'am?
HPV is human papilloma virus.
Okay.
It is contracted through close genital skin contact during sexual activity with an infected person.
Okay.
The virus enters the body through tiny breaks in the skin. It cannot be spread through blood or other body fluids. HPV is the most sexually transmitted infection, though it is not always transmitted sexually.
Okay.
HPV infects both men and women.
Okay.
Someone can be infected with more than one type of virus at a time. Though rare, HPV infection can be passed from mother to child when the infant passes through an infected birth canal.
Okay. All right. So these are the major ways with which HPV can be contracted.
Yes.
Okay. Now, so how do we know? How does someone know that they have contracted this virus? What are the signs and the symptoms?
The signs and symptoms.
Okay.
Most people infected with HPV do not show any symptoms and are usually unaware they are infected.
Okay.
This makes it possible for them to infect others. It can be spread even when condoms are used. Some HPV-infected people develop visible genital warts or have precarious changes in the cervix, vulva, anus, or penis. And these genital warts, some people might say, it's a pimples, something like pimples, you understand? So one has to be very, very careful.
Okay. Okay, is that the major sign? Are there no other signs? Is this the only sign?
No, those are the major signs.
Okay. All right. What can you do to prevent this virus? Because we know that. Okay, let's hear you. What
can be prevented in young adolescent girls aged 9 to 14 years by vaccination. However, in the general population, it can be prevented by the following: delayed sexual activity, limiting the number of sexual partners, use of condoms. Condoms do not eliminate the risk of HPV infection. Condom can only protect the area it covers.
Okay.
So, did you get my point?
Yes. What's the prevention? You said limiting your sexual partners and delayed sexual activity. These are the ways to prevent the human papilloma virus. Are there any other ways that you want us to talk about?
Yes, like HPV and cervical cancer are responsible for almost all cervical cancer cases. It's also responsible for other cancers such as penile, throat, vulva, and vaginal cancer. Most times, HPV goes away by itself within 2 years and does not cause health problems.
Okay.
It is thought that the immune system fights off HPV naturally. It is only when HPV is safe in the body for many years that it can cause cancer. It can cause this cancer.
Okay.
So then, testing for HPV and cervical cancer is key. The screening does not test for the disease, but it helps to identify if an individual is at higher risk of having the disease or as a precaution to the disease. Regular cervical screening, pap smears, is advised even if the woman has been vaccinated.
Okay.
As HPV vaccine does not protect against all types of HPV that can cause cervical cancer. All women from 25 years to 74 years of age or who have ever been sexually active should have a cervical screening test every 5 years, regardless of their HPV vaccination status.
Okay, so this screening can be done only by people who are sexually active?
Yes.
Okay, so they are the ones that are, they have a high tendency for getting this virus, like you said.
That's why they want to prevent it from our young adolescents.
Okay.
Mm-hmm.
All right.
All right.
What is the treatment for HPV and cervical cancer?
There's no specific treatment for HPV infection itself, but there is treatment for pre-cancer, which is very effective in preventing the progression of HPV to cervical cancer, but no specific treatment.
Okay. What is pre-cancer? Because it looks like before cancer. You say treatment. What is pre-cancer?
That is it. Before it is well established, really that it maybe like
before you're diagnosed. Okay.
Exactly.
Okay. Now let's talk about this vaccine.
All right.
Let's talk about this vaccine. We hear that, there is a campaign for the screening being done and the vaccine. What are these vaccines? Do they have side effects? Who can take these vaccines?
You see, HPV vaccine, there are vaccines available for the prevention of HPV in Nigeria.
Okay.
The approved vaccine for HPV prevention is called Gardasil 4. It is a single-dose vaccine administered to girls aged 9 to 14 years. The vaccine is an inactivated, not live vaccine. The vaccine provides the best protection when given before onset of sexual activity. However, people who are sexually active also will benefit from vaccination.
Okay.
The vaccine is administered as an injection intramuscularly in the deltoid region of the upper arm to angle 90. The vaccine is not to be given intravenously, intradermally, or subcutaneously.
Okay.
So then, coming to the side effects of HPV vaccine. HPV vaccination is very safe. Like any medication, vaccines can cause side effects, including pain, swelling, headache, tiredness, or redness. Where the shot was given, that's normal for HPV vaccine and should go away in a day or two dizziness or fainting, as been reported among adolescents who receive HPV vaccine and other recommended vaccine as well. It's just like any other medication that we have reaction as well. It is best for the patient to sit down during vaccine administration and remain seated for 15 to 20 minutes after receiving the vaccine.
Okay.
So that is just it.
Okay, so there are no extreme side effects to the normal ones.
You see, just like this paracetamol that we abuse every day. We see, there's what we call idiosyncratic, that's abnormal reaction.
Okay.
Some can come quite okay, but to God be the glory, because we have no witnessed such.
Any case.
HPV vaccine is very safe.
Very safe.
And it's highly efficacious and effective in preventing cervical cancer. So the HPV vaccine is approved by WHO and the federal government of Nigeria.
All right. Now, let's talk about that. How accessible is this vaccine? Because a lot of people have the opinion that it's pretty expensive and not many people are able to afford it.
Our own is safe. It's free and it's free.
It's free?
It's safe and free. It's free, yes.
Okay. So your HPV vaccine is free.
Paying a lot of money from hospital, but ours is free.
So where can people access this free treatment for the HPV?
not treatment, vaccine.
I beg your pardon. The vaccine. Where can people access these vaccines?
Our PhD centers, designated PhD centers.
Primary
and
healthcare.
Again, during the campaign now, there's going to be outreaches, and again, it's going to be routinized inside our normal routine program.
Okay. So it's accessible in any primary health care center?
Yes. No, designated. We will get across to you if that is ready. We have designated ones.
Designated ones. All right. Please do us well to give us that information when it's available so that we can pass across to our listeners.
Exactly. Thank you very much.
For everyone listening, of course, you can visit the primary health care centers. I'm sure, would they be able to direct you from the primary health care centers, the designated centers, that you can receive the vaccines?
Yes, they will.
All right. So the easiest thing to do is just stop by a primary health care center and ask questions.
Of course. Yes.
All right. Thank you so much for that.
Thank you very much.
Now, let's talk about PAP test, because it's a thing with the whole HPV, the vaccine, and all of that. What is PAP test?
What is what?
PAP test.
Papping?
Yes.
Well, when we advocate to the stakeholders. We have stakeholders meeting where we have our traditional leaders, where we have our education, we have executive and chairman of UBEP, the directors, the principals, and we went to the schools, the teachers, as well as the market. We went to the communities to sensitize them, to let them know what HPV is all about.
Okay. All right.
Yes.
I was asking of the PAP test, but let's move on from there. We see that a lot is going...
Pap smear.
Yes, Pap smear.
It's still part of screening now.
It's part of the screening.
That's why I said, yes, you can still go for it in the hospital.
Okay, so how often can...
From 45, you can be doing it for 5 years. So to be sure of yourself.
From what age?
45.
45.
Yes.
Okay. So you say from 5 years, like every 5 years, you can do a pap smear.
Yes.
All right.
Yes,
so people below that age, the age of 45, cannot, they are not advised to do a pap smear test.
Except if they are seeing signs, they will go and see their physician and he will direct them appropriately
to do that test. All right.
Exactly.
Let's talk about the advocacy of, the HPV vaccines and all of that. We see that a lot is going on in the FCT right now. Please, can you enlighten us on this?
Right. Yes, we have advocated now to the schools. We want to see the principals and the stakeholders, the traditional leaders in all across the 6 area councils. Okay. We have meetings with them and we sensitize them as well.
Okay.
We will create awareness in the communities and let them know that, yes, this program is on board, and all the schools, the principal, the teachers, and sponsors are sent to their parents. Okay. It's not mandatory.
Okay. So what's the response rate for this advocacy? What has been the
according
response?
To the survey, it's 100%.
100%.
A lot of people have been assessing it even before now. In other countries, both female and male are being vaccinated for this. Okay. But just because our government doesn't have the money, so just to start with this target age group, that's why we are starting this 4th phase.
Okay. All right. So let's talk about HPV and the adolescent age before we wrap up this conversation. Right. Yes.
Okay. The HPV vaccine does not treat existing HPV